Dear colleagues, welcome to this first webinar of the series on disability inclusive social protection, which will focus on approaches to measure disability-related costs for inclusive social protection. My name is Alexandre Cote. I am social policy specialist for UNICEF, specializing on disability inclusion, and I will be your moderator today. This webinar is part of a series that we are organizing with many colleagues from the World Bank, FCDO, DFAT, ILO, and other colleagues to promote the work that we have been collectively doing on developing a joint guidance on disability inclusive social protection systems. There will be 5 thematic webinars that echo the conference that we had in 2022, to which many of you took part. So the first webinar will be on measuring and addressing disability-related costs, which is today. The second webinar, which will be on the 6th of June, will be on inclusive care and support system strengthening, which is not solely a disability issue, but really how we can build gender responsive, disability inclusive, and age sensitive care and support system, and the connection to social protection. The next webinar will be on access to healthcare and assistive device for people with disabilities and the role of social protection in facilitating this access. The penultimate webinar will be on disability identification, assessment, and certification for the purpose of social protection in low and middle income settings. And the last webinar will be on income security for people with disability, with a focus on the role for cash benefits. So focusing on the this first webinar, we have been talking about disability-related costs for a while now, and I think many of you have participated in some of the webinars that we had in 2021. This is also a topic that we covered extensively in the course that we are doing with the Bonn-Rhein-Sieg University. And a lot of different work have been done in the last few years with more literature review, more studies that have been carried out, but also more thinking about how do we use different approach to measure disability costs to inform the design of social protection system for supporting inclusion of persons with disabilities. So this is really what we would like to focus on today, and I'll come back to them. So this session is being recorded, and it will be available on socialprotection.org and will be shared with all the people that have registered. We have closed captioning, and we have sign language interpretation. Please share your impression about the webinar on X, hashtag sp.org webinar, hashtag disability series. We will start with a short introduction, and we will have an overview of the recent disability-related costs studies that are using different methodologies. So we won't go in depth because we had other webinars really detailing the result of some of those studies, but we want to provide you with an overview of what came out from those different studies. Then we will focus on the added value and limitation of different methodologies to inform policy and program design. There are different questions that the social protection system are asking themselves with regards to supporting persons with disabilities, and we will see what kind of methodology to assess disability-related costs can inform those questions. And finally, we will have an example of how do we use the data or the information provided by disability-related cost studies to develop more optimized and more responsive support package for children with and adults with disabilities. And we will have an example from Georgia for children with disabilities. As we move through the webinar, please use the chat box to present yourself and to make any comments or share interesting links that you may have about different research that are related to the topic. If you have any question for the speakers, please use the Q&A box. Don't use the chat box. Use the Q&A box, and please, before you state your question, let us know which speakers you want to address this question to, so that we have a bit of context and our speakers can more easily address those questions. We will monitor both the chat for the comments and the Q&A for the questions, and we might address some of those questions live. So who are our speakers? They are actually some of the leading specialists on the issue of disability-related costs. We have Daniel Mont, who is the CEO of the Center for Inclusive Policy, who has previously worked as senior economist for the World Bank and has an extensive experience on disability data. Many of you might know him for the work that he has been doing around the Washington Group short set of questions and other issues related to social protection. We have Morgon, who is associate professor at the London School of Hygiene and Tropical Medicine in the International Center for Evidence on Disability, and has dedicated her PhD and have carried out many research around social protection for persons with disability. Ludovico Carraro, who has worked for many, many years with Oxford Policy Management, and that has an extensive experience on supporting development of eligibility determination for social protection, with an attention in later years for disability. He is one of the pioneers on using disability-related costs to adapt social protection programs. Maia Bagrationi, who is the consultant working with UNICEF and is also working with MAC Georgia, an NGO that is supporting service provision for children with disabilities in Georgia. She has been extensively involved in the study on disability costs for goods and service required by children with disabilities in Georgia, and is currently supporting UNICEF in developing a support package. And finally, Andrey Tretyak, who will close this webinar, with a senior social protection policy specialist at the World Bank, and had an extensive career with Expertise France in advising many different countries on social policy, social service development, including with regards to persons with disabilities. So I will now give the floor to Daniel Mont, and I will invite all the other speakers to switch off their camera. Daniel, the floor is yours. You are muted, Daniel.
Hello, everyone. You need to allow me to share my screen right now. It says I can't do that. We're here, it's a pleasure to be here to talk about approaches to measure disability-related costs for inclusive social protection. Let's see if I can share. Okay. Well, the first question to ask, of course, is why are we so focused on this? Why are we spending so much effort to try to measure and incorporate disability costs? And it basically boils down to the fact that people with disabilities incur a variety of costs that people without disabilities don't face, right? They have necessary things that they need for their lives that people without disabilities don't. And therefore, if those are not accounted for in social protection policies, it's not possible to eliminate the inequalities that they face, right? Equal treatment to people who have different levels of needs is really not equity. So when we talk about costs, there are several different types of costs, and they boil down to two categories. One is direct spending. In other words, the money I need to take out of my pocket in order to buy something. But there's another kind of cost that we call indirect costs, which is a reduction in the ability to generate a livelihood. So when we talk about direct costs, they fall also into two categories. Some of the things that people with disabilities need are disability specific. For example, a wheelchair, assistive devices, a sign language, for example. These are things that people without disabilities don't need. However, there are also extra expenditures on general expenses. So health, transportation, housing costs. These are things that all people spend money on. But people with disabilities often have greater needs in those areas and incur extra expenses there. So when we talk about the direct cost of disability, we're not just talking about those disability-specific expenditures. We're talking about the full range of extra things that people with disabilities need to spend money on in order to be living in an equal situation as people without disabilities. But there's another kind of cost, and that's the indirect ones. And that's when households that have people with disabilities in them have lower levels of income and consumption. Why is that? People with disabilities may have fewer educational opportunities and fewer employment opportunities, so they can't earn as much money. And then other people in the household may have to step in and provide support to people with disabilities because they lack the means, the support they need to be independent. And so a mother or a spouse of somebody with a disability may not be able to work as much, or may have to take a lower paying job that's more flexible in order to be able to provide that support. In this study, where we're talking about the real focus, the main focus is on those direct costs. So it's not on the fact that people with disabilities and their households are earning less. It's the fact that they have greater needs that have to be covered. And if we don't take these into account, we're really underestimating the impact of disability on the economic well-being of households that have people with disabilities in them. So in this graph, we see a blue bar and an orange bar representing two households, one with and one without a member with a disability. The bars are the same height because they have the same income, but they don't have the same standard of living because the household with the member with a disability has those extra costs. And a household has one of two choices. One, they can spend money on those disability-related costs and therefore have less money for food, shelter, and other things that all households need. Or they cannot spend money on those things and have enough at the same amount of money for food and shelter, but they'll be denying the people with disabilities in those households the things they need to participate equally, and thereby undermine their level of well-being. So either way, there's a loss in economic well-being if those disability-related costs are not covered. So what do we get out of trying to do this work? One thing we do is get a deeper understanding of the economic disadvantage that people with disabilities and their families face, and a better idea of how many of them are living below the poverty line, because official statistics will say there's a certain percentage of people with disabilities living below the poverty line, but in effect, when we take into account their extra needs, it's actually greater. And so taking this information into account, we can use that to try to adjust how social protection benefits are delivered, maybe changing the eligibility threshold, maybe changing the value of the benefits that they are given. There's different approaches to doing that, which we will talk about more later in this webinar. How do we develop a combination of cash, concessions, tax credits, service delivery, in order to try to cover those costs as efficiently as possible? And another very important thing about these studies is that they provide evidence for informed dialogue between stakeholders. And as I'll talk about in a second, we really want to have a participatory approach. We really want to get all the stakeholders on the same page with a common understanding of disability costs so they can address them in a uniformed manner. So, but measuring disability costs is just one step in the policy development, right? I mean, the first thing we need to do is understand what are those disability-related costs. Is it transportation? Is it rehabilitation services? Is it household modifications? Is it special food? What is the structure of those costs, and how are they different for different people with different types and degrees of disabilities? Then the next thing we want to do is look at, okay, what are the various intervention packages? What are the various policy levers and tools that we can use to try to meet those costs? And then finally, developing a budget and a delivery system, within our fiscal space, within the capacity of the country at that time. How can we develop a practical plan to implement a social package that meets the needs of people with disabilities to the extent that we can? So how do we do this? What are the methods? There's 4 methods, but they kind of fall into 2 categories. One group of methods looks at what is currently being spent right now by people with disabilities and their households. And then the final method we're going to talk about is looking at what is needed to be spent for equal participation, because people may not be spending all that they need in order to have equal participation. Okay. So the first method is what's called the standard of living method, or SOL. And it measures the level of consumption of households with a person with a disability, what the level of consumption they need to have in order to have the same standard of living as a similar household without a disability. So we use a nationally representative household survey. There's an econometric technique. Ludo will talk more about that. But basically, we get that household survey and it tells us, oh, okay, for a household with a disability to have the same level of well-being as a household without a disability, this is how much they need. Okay. Related to this is something called the consumption pattern analysis, which uses similar surveys to see how spending patterns differ. So do households with a person with a disability, do they spend more on healthcare? Do they spend less on education? In order to see what are the priorities of households with members with disabilities, where are they spending their money? And by combining these 2 methods, that can tell us what is currently being spent on disability, and how it's distributed across major consumption categories. Okay, but it's not telling us on a detail on how that money is being spent. And that's what the goods and services used approach tries to do. Households with members with disabilities are directly asked about the expenditure. So there's a survey or an interview and goes in there and says, okay, let's talk about your day and your life and what you do and what you buy. And let's try to get a detailed accounting of where you believe you're spending money that you're spending that's related to the fact that somebody in the household has a disability. Okay. The final method is goods and services required, which tries to capture what people need to participate on an equal basis with others. So we go in and we ask people about their needs and their unmet needs. Again, we'll talk more about this procedure later in the webinar, but basically by talking to experts, service providers, people with disabilities, parents, coming together and through both qualitative and quantitative approaches, trying to come up with what are those expenditures. And it could be done in sort of an explorative way or a more detailed way. But before I get to that, I just want to talk about this basic idea of what is being spent and what is needed, right? Why might people not be spending what they need in order to equally participate? One reason is people may not have enough money to buy what is needed, right? We might do a standard of living estimate in a poor country and find out that people aren't spending very much on disability costs. And that might be just because they don't have the money to spend on it. Or they may not be aware of goods and services that could help them. Or maybe they are aware of them, but they're not available. They're not available where they live. And unfortunately, a final reason why there might be a gap between what is being spent and what is needed is discrimination within the household. The household might decide that they don't want to put their resources towards the person's with disabilities needs. Okay? oops, and it's very important in doing all this work to have a participatory approach, especially with the goods and services required, for a number of reasons. First, we need to incorporate the lived experience of people with disabilities in a local context. Who knows better than someone with a disability what are the kinds of barriers they face? What are the kinds of things they need to try to overcome those barriers? What do they need to get through the day? It also improves the understanding of the methods used and the strengths and limitations of the results. Everyone comes on the same page. There's a common understanding. People learn about each other. People with one type of disability learn about people with another type of disability, and come to understand their situations, come to have a common language about disability costs. And I think it builds understanding and also helps in the politics behind trying to come to a consensus between civil society and the government. And I think, hope I didn't go over. Now I think I turn it over to Morgan, who will tell you, give you an overview of some of the results of countries that have done this kind of work.
Thank you very much, Daniel, for this introduction. Always very clear. I just wanted to, before we go to Morgon, so one thing that is very important is that those different methods are being implemented across the world. I would say more and more in lower and middle income countries, but we still have more data from higher income countries, but there are more and more research. And Morgon has carried out a literature review, an update of the work that has been done by Daniel Mont and Sophie Mitra years ago to get a sense. And I think, Morgon, you were quite surprised by the increase of the number of research that have taken place. Morgon, the floor is yours.
Great. Yes, thank you, Alex, and thank you, Dan. So that is right. We did do an update of the article that was done by Sophie Mitra, Dan, and others that was published in 2017 and covered the literature on extra costs up until 2014. So we updated that going from 2015 to the start of 2023. So just within a 7-year time frame, we found that there was an additional 75 studies published. So that really demonstrates that there is an increasing interest in this topic from both researchers and policymakers. I will say that there is still most of the evidence is coming from higher income countries, with 61% of studies from high income countries and 24% of studies from upper middle income countries, and only the remaining 15% from low and lower middle income countries. If we look at the breakdown in studies across the 4 methods that Dan mentioned, the largest share was for the SOL method, which was at 32%. And then there was the CPA approach at 29%. And this can reflect that there is an increasing use of disability questions, particularly the Washington Group questions, that are getting added to national surveys like household income and expenditure surveys. So that makes these types of calculations much more easy. We have much fewer studies. There was only 6 studies that used the goods and services required. So we still are lacking data using the GSR in order to see what people not only are spending on, but what they require. Here is a graph that's summarizing the value of extra costs using the SOL method, the standard of living method, looking at the estimated value of extra costs as a proportion of household income. And we can see here that there is a clear difference between low and middle income countries, where the average is about 15% of household income, versus for high income countries, where the value is about 43% of household income. And you also see that there's quite a range across different countries. Now, I want to emphasize here that, as Dan mentioned in his previous slides, that there are a number of reasons that there could be differences between settings. And importantly, this is just measuring approximated spending. It's not measuring what people require. So just because costs are lower in certain areas, particularly low and middle income countries, that doesn't mean that the need is less there. And when we use the estimates of extra cost to see how it affects poverty, we see that even taking in this very modest estimate of extra costs, so just what people are potentially spending on, we see that poverty increases from 25% in the Philippines up to 168% or 2% in Spain. So really big impacts on poverty, and this is even a clear underestimate. So as I mentioned before, there were 6 GSR studies that were eligible for the time frame of this study. They were all from high income countries, and they showed very large costs when we look at the goods and services people are not only spending on, but what they require. So my apologies, the legend is missing, but the red bars represent people with more severe disability, and the blue bars represent people with more moderate disability. So this graph shows quite a clear difference by severity level, as well as by disability types, and very high overall spending. So the highest level, we see almost 90,000 USD per year for people with severe physical disability in New Zealand. There were a number of factors that affected costs when we looked across the studies and what the authors of the individual studies analyzed for. So clearly severity affected costs. So in every study that looked at differences by severity, more severe forms of impairment increased costs. Costs were also generally higher for children and younger adults, and in single adult households compared to multi-adult households. And there wasn't a very clear relationship between household wealth, gender, and rural-urban differences. So there were differences between studies. So this is something that needs to be explored more. There were also some reports of the role of social protection across the studies. So amongst those that compared the value of extra costs to benefit levels, they found them almost always very insufficient. So for example, in the UK, only about 15% of what people were spending was covered by the current cash transfer system. There was also some evidence, though, that appropriate social protection policy can be very useful in reducing these costs. So, for example, in Turkey, when they implemented a universal health insurance scheme, authors of one study found that this decreased disability-related costs by 2/3, and these are total, not just health-related. Similarly, in the US, when there were changes to the reimbursement policies for mental health conditions so that people could have a higher level of reimbursement when they went for mental health services, this reduced spending by $150 a year. So I want to do a bit of a deeper dive into some recent studies, some of which were covered in that review and some of which have come out since the searching for that review was completed. So the first study is a goods and services required study from Georgia, which Maia will speak to more in a little bit. But what this graph shows is that when the goods and services required approach was used, we see very high costs across different types of disabilities. So at a high end, you've got people with deaf blindness and high support needs that are spending the equivalent of about $2,200 US. And there's also a lot of variation in terms of the sources of extra costs. So human support is a large source of extra costs for groups such as people with deaf blindness or people with physical disability, but might be only a small portion for, say, people with hearing, low support needs and hearing impairment. So we can see that there is diversity, but also some common drivers. Also in Georgia, we see that the current potential share of government spending is not covering a large proportion of required expenses. So it's often less than a third of required expenses. And this also varies between groups. So at a low, people with physical impairment, it's about a fifth. For visual impairment, it's a bit less than half. There was also a study from the Philippines, which used SAL and CPA. So with SAL, they found that a household with a child with a disability needs an expenditure that's 40 to 80% higher than similar families with children. And when we looked at common sources of spending, health was a major source, so 3 times higher, and education was also higher, even though children with disabilities were much less likely to be enrolled. Here also, we can see that there are differences between unmet needs and spending. So generally, households with fewer unmet needs were spending more. And then the final study is from the US. So this used a survey approach to capture current spending on disability-related goods and services, as well as unmet needs. So what this graph is showing is that spending tends to increase with higher incomes. And also generally, although there's some differences, there is a trend towards decreased unmet needs with higher incomes. And if we look at the domains where people are spending and where people have unmet needs, so health is a large source of both spending and unmet needs. For example, 68% of people were spending on health-related goods, but 25% still had an unmet need. So there's quite a variety here of different goods and services required. I'm going to now turn over to Ludo.
So before we do that, Morgon, thank you very much for your overview of all those results. We copy-pasted in the chat the link to some of the report, as well some of the papers that have been written, so that you can go more in depth with regards to some of the data that was shared by Morgon. We have a question from Danilo, which I would like maybe to give to Daniel and Morgon. Danilo mentioned, assuming that low-income countries households have less income available to spend, and adding the fact that you just shown that the household in low-income settings spend relatively lower portion of their total income, it basically indicates that low-income countries households spend significantly less on needs of household member with disability, regardless of the reason, which is in a way expecting, but it's interesting to see how large our difference in relative portion of household expenditure between country settings. So maybe Daniel, you could come in and elaborate a little bit more on those differences, and Morgon also, if you would like to, those differences between what we see using, for instance, the SOL method between low-income settings and higher income countries. Daniel?
Right. So, so the SOL method is looking at basically what is being spent right now. And as I said in the presentation, there's a reason why what is being spent right now is not necessarily what is needed. So if I'm living in a poor country with fewer resources, I may not have the budget, I may not have the ability, I might not have the availability to get the things I need, and therefore I'm not spending very much. So the economic well-being of the household is only being affected a small amount in terms of the direct costs, not the indirect costs, right? There might be big indirect costs in the fact that the household isn't earning as much as they because of a disability, but just looking at the direct costs, there may not be much of an economic impact on the household, but there could be a big impact on the well-being of the person with the disability in that household because they're not getting what they need, right? So the SOL method is, to use it, we really have to understand what it's focusing on, what is being spent right now. Whereas when we look in the richer countries, those families have more resources, they have goods and services are more available to them, they have more knowledge about what's out there, and so they have the ability to spend more money. So we really have to think differently between, the way I like to think about it is expenditures versus costs. There may not be very high expenditures going on in some poorer countries, but that doesn't mean that the required costs of disability are not high.
Thank you very much, Daniel. We have another question from Israel Balogun, and this one may be Morgon for you. The studies that you've looked at, which are many different studies, did they factor about different type of person with disabilities and different type of functional limitation? Were some of them impairment specific? Is it a mix of those? Can you elaborate a little bit on this?
Yes. So there was lots of variations between the different studies. Some of them used the Washington group or other measures that covered a wide range of different types of disabilities or functional domains. And then some of them were really focused on certain impairment groups. So physical, vision, things like that. I'll say that the review is processing. It's under review. The review is under review, and hopefully will be publicly available soon. But if you do want to email me, I can share a draft version.
Thank you very much, Morgon. And indeed, in the work that we've been doing in the different study, Israel, we have looked, for instance, in Georgia. If you read the report that is in the link, there are different groups of children with disabilities. And what we've done was to look at, for instance, children with physical disability, with high and low support needs, children with intellectual disabilities, with high and low support needs, as well as children with multiple forms of impairment and functional difficulties and complex needs. And the why we did it per group like this is because each group of children with disabilities with different type of functional limitation will face different barriers and have different type and level of support needs. So when we use the GSR method, it allows us to go into this kind of details of the specificity of different groups. So you will find this information and a look on the methodology used in the Georgia report. So pausing now on the measure and the studies themselves, we will move now to Ludovico to see what's the relevance of those different methodologies to design and implement social protection programs, and how studies on cost of disability can answer some specific questions that social protection system and actors may have. Ludovico, the floor is yours.
Thanks, Alex. Yes, so if we look again at the main outputs that come from an assessment of disability-related cost, we find four main elements. So the mapping of existing programs and services, an assessment of the current level of disadvantage that is faced by people with disability, and by that we mean specifically an assessment of the disability-related cost. So we quantify those disability-related costs, and we look at the structure of this cost. We then have an assessment of sets of goods and services required for participation, and also an assessment of what are the met and unmet needs of people with disability. And finally, we have the identification of possible areas of intervention. And it's on this final outcome that I would like to make some reflection and pose and understand how some questions can be answered by the different methods when we look at the policy area of intervention. So the first question is, do people with disability have lower incomes than others, and are they likely to fall below the poverty line? So if we don't use any assessment of disability-related cost, and we just look at the simple comparison of incomes or consumption expenditure of people with and without disabilities and their families, what we usually find is that people with disability and their families have lower incomes and lower expenditure, and therefore also tend to have higher poverty rates. But if we don't measure this disability-related cost, we underestimate the extent of these higher poverty rates. And the goods and services required approach, and here I'm specifically referring to the explorative GSR that is more likely to be employed in developing countries. We don't have exact estimates of incomes, and we generate primarily illustrative cases. So this methodology cannot be used to assess the impact of disability-related cost on poverty. And for the goods and services used, we have the possibility to estimate the disability-related cost, and we detract this from the consumption expenditure that households have. And so with this methodology, we can estimate the impact on poverty in a better way than not using any assessment of disability-related cost. But this tends to be an underestimate because it's primarily based on, exclusively based on what people spend. Yeah. The SOLE method, although is also focusing on actual expenses, it does control for income and standard of living. And so usually generates estimates of the cost that are higher than those of the goods and services used. And although it has a lot of limitation, being implemented in the same household survey that are used to estimate poverty is the approach that can be used to correct poverty estimates. And so is the approach that is that is available to estimate the poverty impact. The big clarification that we need to make is the one that we discussed also so far, that if needs of people with disability are largely unmet, there are not many of the services and goods that people with disability need, then the expenditure will be heavily underestimated. So there is a condition for which this method can be used, where these expenses do exist, at least in the middle income households or higher income household. These goods and services need to be present. But if we have an estimate of the disability-related cost, then this has a number of significant implications for social protection programming. And many countries have a mainstream social assistance program that define the eligibility based on income and an income assessment, either a means test or a proxy means test. And if we have an estimate of what are the disability-related costs that are faced by households with members with disability, then the implications are two, that there is a need to adjust the income assessment and the identification of people that are eligible to social assistance, and also an adjustment of the value of the benefit to which they are entitled. The second type of use of an estimate of disability-related costs is to advocate and benchmark the value of a possible disability allowance. For example, one of the uses of the study that was recently conducted in the Philippines has been to benchmark the value for a disability allowance. And a third use is again to advocate and benchmark a possible value of a caregiver's allowance for a subgroup of households that people with disability that have high need supports. What we should remember is that if the cost of the disability-related cost is estimated through the standard of living method, this will tend to be an average cost that sometimes differentiate by severity of disability, but it will not be sufficient to address the diversity of needs. So all these adjustments are focusing on cash benefits, but cannot be the only solution. They will need to be complemented by provision of services and in-kind benefits. So the adjustment of the assessment of needs can be done in two ways. Yeah, the first one is to use the estimate of an average household cost that can be used to correct the consumption expenditure. And the second one is to actually calculate the equivalent scale that a person with disability needs. So that is a form of assessing the needs in terms of equivalent adult, in terms of their overall consumption expenditure need. The two methods provide similar results, actually the same results when, on average, when we apply this measure, these two different methods to estimate the impact on poverty. But for designing cash transfer and cash benefits, what we need is to use the second approach. So to use an equivalent scale for people with disability. And here we just look at an example of an adjustment that we do to a means test assessment. So we have in this graph an example of 5 households that have different incomes, and we assume that there is a certain threshold under which people are eligible to receive assistance. In this example, there are 3 households that fall below the threshold, and we can also depict the amount of support that each of them is entitled to. But let's assume that 2 households of this have a person with disability. And once we take into account the disability-related cost, what happens is their assessment of adult equivalent, income per adult equivalent, reduces. And so even if the first household was not eligible, now becomes eligible. And also the second households, although it was already eligible, the amount of support that they are entitled to after the correction of disability-related cost increases. And this is the method that has been used, for example, in Moldova, in their means-tested benefit. For proxy means test, what is required is to change the underlying model that assessed the eligibility for households to social assistance. And this is done, again, adjusting the welfare indicator using equivalent scales that reflect the needs of people with disability through the SOL estimates, and reassessing the eligibility determination criteria. And after doing this, what happens is that more households that have members with disability will be entitled to social assistance. And we have seen this, for example, in Mongolia and Georgia, where this was done, this correction was carried out. And secondly, we don't only recognize that there are more people that fall below the eligibility threshold, but also we need to recognize that on average, people with disability that fall below the eligibility threshold are also more likely to have higher needs. And so the benefit that they will be entitled to will also be adjusted proportionally. And this, for example, happened both in Zambia and Georgia. On the other example of the caregivers and the third person support allowance, the household surveys will have information on whenever there is a Washington group questions are implemented. It will be able to identify households that have members with disability with special needs for self-care. And that is an indication that they require special support from a caregiver. Now, most often, unfortunately, the care and personal support doesn't translate in an out-of-pocket expenses, but women and girls most often in the household will be dedicated to support the household member and will have indirect costs in terms of opportunity cost, in terms of loss of earned income. And so assessing these situations through and verifying to what extent, in these cases, we have higher disability-related costs, we have higher indirect costs and lower incomes, and large unmet needs. Those will be criteria that would allow to identify and benchmark a top-up support for households that have for members of the household that have self-care needs. Let's come to the second question. So, on what goods and services are people with disability having direct disability-related costs? And as we already briefly mentioned earlier, the consumption pattern analysis in combination with SOL often provides some clue of what are the main sources of expenditure, but is relatively limited. And more than that, what is this method is unable to distinguish and differentiate between the expenses by type of disability. These are issues that instead are better addressed by the goods and services used, where a survey focused specifically on different type of disabilities and on their type of expenses. So we will have much more clarity on the type of expenses that are incurred across the different type of disability. The goods and services required will also provide this information, and more than that, because it will look also at what is required, but usually it doesn't do that in robust estimates. But we will come back to this later. So what are the implications, again, for social protection policies? Well, if the goods and services used allow us to identify the specific items, goods and services for which people with disability may incur expenses, then we can cross-check this with what the government is currently providing and determine whether there are certain type of disability that remains need to support a higher burden of expenses, specifically perhaps on transport or on rehabilitation. And this enabled to adjust and develop new solutions. In the case of the study that was done in the Philippines, for example, there was an assessment of what is the support that is provided through concessions and discounts that are given to people that have a recognized status of disability. And what we found was that it was primarily the relatively better off, those that are in the fourth and in fifth quintile, that were receiving the bulk of the subsidy. And the reason for this was just the way in which the concessions are designed, so that people in rural areas have less opportunities to buy from formal establishment and so to receive this discount. And secondly, the only in order to receive the 20% discount, they need to spend the 80%. And so those that have a lower income are less likely to receive a substantial support. And this is telling us that the level of concession and the way in which it's designed need to be reformed to increase equity across all people with disabilities. We come to the third and the last questions. So what are goods and services people with disability require? Well, we already know that the best method to answer this question is the goods and services required. So it is in the name. Is the only method that goes beyond what people spend and what government currently provide to identify the list of goods and services that is required. And it does so across the different types of disability. This doesn't come with a precise measures of costs, but enable us to clearly identify when services are missing, where certain type of disability are underserved. And the implication for social protection is that we could, for example, look at assisted products that are currently provided by government and identify some that for certain type of disabilities are missing and should be, the list should be expanded, or would be the basis to for the creation of habilitation and rehabilitation services, or for the design of concession policies for specific items such as diapers. Or again, could be the basis to plan the need for respite services for caregivers. And this has the power to address policies across diversity of needs. And on this, I think Maia will provide more concrete examples as well. But really to provide an overall summary of the different methods, all of them have the capacity to do a mapping of existing support. The quantification of cost is done by the CPA SOL in a way in which can be used for cash support, but the level of diversity across disabilities and the level of services required will only be addressed through the GSU and GSR. And finally, the last two methods, which will involve new data collection, will also have the capacity, the possibility to contribute to create more political support for reform and awareness among the population. But so there is no one method that provides all the answers. And so what we often recommend is to look beyond one method and always try to combine, depending on what is the policy issue at hand, what is the also expectation from government is to combine these different methods. So a combination between GSU and GSR would provide, for example, the information that is required for estimating number of people that have certain needs, or the development of a GSU survey will have a positive feedback on future round of household income and expenditure survey that could include questions that would increase the usefulness of a SOL analysis. And actually, we are just now starting a project in Malaysia where we are trying to combine all three methods together. And I was just to finish with one slide saying that there are often, when these disability related cost assessments are made, it can be overwhelming. Yeah, needs are very high, and resources are few. There are two principles that should guide the creation of a response. First of all, the emphasis on equity, ensuring equity both across the disability types and across different areas of the country, and also develop phases of that progressively address the needs of people with disability, starting from whatever is currently implemented by the government to improve it, to then identify new services that could be developed, and then progressively improve the support that is provided. But I'm sure on this, Maia will give a very good example for Georgia.
Thank you very much, Ludovico, for all those elements. As you were speaking, we had many questions. For instance, from Danilo, the issue of using, for instance, the SOL method to estimate or to the adjustment of the poverty line or the level of poverty for persons with disabilities, but looking at the diversity of persons with disability rather than an average. And Daniel answered related to that. So one of the issues, for instance, is sample size with regards to how we can differentiate. So for instance, one of the things you mentioned is the possibility to do the work for people with more severe or less severe functioning difficulties and related support needs, but it might be difficult with the data sets that we have to go in more specific details. How would you go about if you wanted to provide a better understanding of the diversity of difference of level of poverty between groups of persons with disability, Ludovico?
Well, what I would say is that so we use SOL for a very specific purpose, yeah, that could be related to this cash support and the modification of the design of this support. But by all means, SOL will not address the needs of different type of disabilities, and that is how you complement the SOL, that is a cash level intervention, to a level of a GSR, for example, that will give you information of in-kind benefits that will address the diversity of needs that exist across disability type. I don't think there are countries that are able to, even if we had the data, to provide different cash allowances for different disability groups. Yeah, that is not the way to answer the needs of those people. Is through services and tailor support that then we address the diversity of needs.
Thank you, definitely, Ludovico. And one thing that also
I think we lost Alex.
Yeah, I think he's frozen. While we're waiting for Alex to come on, let me also say that we're talking about providing goods and services or cash. Another way to address these extra costs is removing the barriers that drive them up. For example, people might have high transportation costs. One strategy is to give them money to cover transportation. An additional strategy is to make public transportation systems more accessible so that they don't need to spend that much more money in order to have transportation. So there's a whole, we want to understand the whole structure of these costs and come up with a constellation of different types of policies to address them. It's very multifaceted. I don't know if Alex.
Thank you very much.
Okay.
Zoom just disappeared from my computer and came back. Those things happen. So without any further ado, let's go to Maia to see how you have been working with UNICEF to actually use the data that came from the disability cost study using the GSR method to work on the reform of the package of support for children with disabilities. Maia, the floor is yours.
Sure, thank you very much. And so with my short presentation, I will give an overview, as Alex mentioned, how we use the results of GSR study to optimize support packages for children with disabilities in Georgia. First of all, what I want to mention is that this study really gave us a clear understanding of the needs of children with disabilities and their families. Because as it was already mentioned, in Georgia, we have differentiated 8 groups of disabilities, and we have analyzed the needs of each disability group separately. But consolidating the data of their needs really gave us a fruitful insight about their needs and about the available support system, and also about the gap which exists between the required and existed support. Of course, this data gave also a great platform for the Ministry of Health and Social Affairs to start thinking and planning a strategy how to optimize the support packages for children with disabilities. And of course, I should mention that it's very important to have a political will and interest in this regard. And I have to mention that Georgia is now in a good condition, as we are slowly moving from a medical model of disability towards a social model, and we are in the stage of introducing new assessment and status determination system, which will give us a possibility to identify individual needs of persons with disability and provide tailored support packages to them. And of course, this will allow us to move away from one-size-fits-all approach towards targeted packages of social protection measures. And of course, the aim of the government is slowly to develop and expand support that are identified, but it's not yet provided. It's not yet available. And a very important objective of this optimization process is to develop an algorithm to standardize the process of entitlement to social packages. And of course, there are several considerations when, together with UNICEF, the government is thinking how to design the support packages. One of the main considerations is that there will be some support measures that are unconditional and they are not linked to any specific needs. As soon as a person receives the status of disability, this support measure will be provided to him, and this is mainly the cash benefit, which is provided always to those who have the disability status. Some support measures and support components will be linked to and correlated to their health condition, functional difficulties, or social needs. Of course, another important consideration when designing the support packages is information about the evidence of the support components, because the government, of course, requires evidence whether this or that support component is useful for person with disability. And as already mentioned, to develop an algorithm is a very important consideration in this process. So here with this slide, I would like to kind of illustrate the support package which was identified for children with physical disabilities. And here you see that goods and services required are mainly grouped based on the type of support. However, we have introduced the color codes in order to visualize those support components which are already available in Georgia, and those are marked in green. For instance, manual wheelchairs, adapted toilet seats, they are already available in Georgia. In yellow color, you see those support components which are not yet accessible, but there is a strong will and interest from the governmental side to gradually introduce those. And their decision mainly is based that there is a clear evidence on the usefulness of these components, and also most of these assistive technologies, for instance, you can see in the WHO priority list. However, we have also a few support components which are marked in blue here, and here there is not yet a clear decision from government side whether they plan provision of these components in near future. These components actually are very demanded from disability community. However, as they lack some evidence and there is a need for further research, it's not yet decided if there will be reflected in support package and included and contributed by government. Another important consideration when designing the social packages is to identify the key stakeholders who will support provision of goods and services required. And in Georgia, there are 4 main stakeholders identified. Of course, it's the Ministry of Health and Social Affairs, Ministry of Education, and municipalities. And of course, UNICEF has already started dialogue with those stakeholders, and also stakeholders have to have dialogue among themselves to share responsibilities on support measures. For instance, there is a huge need to involve Ministry of Education in provision of assistive technologies, which are very needed for children with visual impairment. And here we also see involvement of civil society organizations, and mainly to support those components which won't be covered by state and the government, either local or central. And those components might be like car seat, therapy sessions which lack evidence but are still very demanded from community, like aquatherapy, massage therapy. So some of these kind of therapies are very popular and demanded in Georgian context. Of course, in order to build and optimize the social packages, it's very important to cost the individual packages, which is relatively easy for Georgia context because of GSR study. However, the government is also very much interested to know the cost of the new social system, which might be a little bit challenging because in this case, we would need to to find out the cost of new services which are not yet developed. Also considering their cost of establishment, infrastructure, workforce training, and so on. And very important to mention the need of expansion of the services. In illustration of social package for children with physical disabilities, you might notice that many components are already provided by the government, but still there is a need of horizontal and vertical expansion of those support components, because we want and we need more services, as well as there is a need that more people have access to those services which are already available or those which will be developed in near future, considering the equity and the equality of the services. So actually, this is my last slide just to illustrate our ideas and the flow of our reasoning, that provision of support packages will start with disability assessment. It will be followed by decision on disability status, and then the last component will be the entitlement to support components. And again, here you see the color codes indicating components which are already provided, those which we talk with the government to be provided in nearest future, and those where we lack evidence, but we will pilot, or we hope to pilot those components and kind of convert in green color. So here I will stop my presentation and will thank you for your attention.
Thank you very much, Maia, for this presentation. We have a follow-up question immediately from Liliane Bernades, who is asking, how many types of support package have been mapped out in Georgia? Each type of package was a possibility of supporting according to needs. Therefore, is there an individualized assessment to define what will be available according to the individual needs? I have a sense that you started to answer the question with your last slides after Liliane posed the question, but could you clarify a little bit the relationship between the disability assessment reform and the development of the support package?
Yes, sure. Actually, to start from the very beginning, we have identified actually 17 support packages, because we, from the very beginning, we have defined 8 groups of children with disabilities, but then within each group, we have differentiated groups with high level of support and low level of support. So in total, we have 17 packages of support. However, this is one step, but another step is then based on the individual assessment to tailor individual packages for a specific child. And of course, for this, we need an in-depth assessment of health condition, functional limitation, and social needs of a particular child. And this system is in the process of being introduced in Georgia. We are at the same time piloting the functional assessment instruments in order to be able to tailor support packages based on the individual needs of the child. But here I also would like to mention that within our GSR study, we have also developed the case studies, which also illustrate how this universal support packages can be narrowed down considering individual needs of particular children.
Thank you very much. Liliane, if you want to follow up, you can also contact directly Maia or our colleagues from UNICEF in Georgia. They will be happy to provide you with more information. Thank you so much, colleagues. I think in an hour and 20 minutes, we have managed to provide first an overview of the key questions related to disability costs, which many of you colleagues have been very familiar with, because this is something we've been talking for a while. Looking at an overview of the results of recent studies. And we shared with you some documents, some links in the chat if you want to go deeper in the work that has been done in the Philippines or in Georgia to get a sense. Very soon we will get another study using the goods and service required report from Peru and from Tamil Nadu, a state in India, that will give you even more information. One important thing I wanted to share with you all is that we are continuing this work, and we will have studies in Moldova, in Nepal, in Nigeria, in Namibia, using different Malaysia, using different methodologies. We are really trying to fine-tune and to also take into consideration all those questions that you have been asking. We are also asking ourselves those same questions, especially with regards to the most relevant methodologies and how to use the result of those methodology in lower income settings. I saw many questions coming. So keep in touch. We will update you as we go through all those research. If you have technical questions related to disability-related cost for some reform that you are currently undertaking, you can contact me directly. I will put my email address in the chat, and I could direct you to people among the speakers, but also elsewhere, that could be able to answer some of your questions. So without any further ado, I would like to give the floor to Andrey Tretyak from the World Bank. Since we have been doing this work together for the last few years with the World Bank, we are trying to find out what are the best ways to assess those disability costs and how we can address them. Andrey, the floor is yours for closing the webinar.
Thank you very much. Thank you. I would like to thank all the presenters, because the presentation was very clear and very interesting. We, as the World Bank, we are following these works as well, and the sum of the study which was mentioned, especially in Tamil Nadu, is made in relationship with one of the biggest projects which the World Bank have in his history on the disability inclusion. So we are using the results of this study in order to render most of our project in the World Bank disability inclusive, which is correspond to the commitment of the World Bank which we should follow by 2025. Most 20-75% of the projects related to social protection should be disability inclusive. So I was very interested to follow all this presentation, but from the point of view of the policymakers, sometimes the easy question can be asked based on all this presentation. What is the overall cost of this or extra cost of related to disability? If we need to cover it, how much it costs? And I know in Georgian study, for instance, for some cases we can go up to $5,000 per month. And of course, this kind of if we would like to present this extra cost only in terms of money, it can be very dangerous from the point of view for policymakers. So I think the main message, which was really good transmitted by all the presenters, that this is cash is not enough. Actually, the package should not be only covered by cash. We should not have this kind of approach. Okay, we estimate the cost of disability and giving the cash to the beneficiary, and then we consider the problem is solved. Cash will never cover all the costs related to disability, and the disability package is very important. Second message I would like to pass is that probably it's not it was not presented here, but it was presented in different studies, that actually the cost occur in different extent in different countries. Why? Because actually this cost partly related to the overall effort on inclusivity of the society. If the society make the effort of accessibility, for instance, of public transport, the extra cost related to transportation of person with disability will be different and can be reduced. Of course, this is not individual effort on the household, on the level of the household for the person where the person of disability is living, but this collective effort can significantly reduce the extra cost related to disability. And we have seen it in many countries that it doesn't concern actually only the person with disability, but it concerns the other groups, other vulnerable groups. One of the better example, actually, the accessibility of France, the country that I know better probably in my life, but in France, the accessibility started to work not when the person with disability was struggling for improving the accessibility, but when the number of older population starting to grow and older population are sitting in the municipality council, because and they started to vote for it because they not only person with disability usually take advantage of the accessibility, but the older person, mother with children, and etc. So one of the main messages started from the beginning: cash is not enough. We need to make, as it was presented, some combined measure, which can start with the in the low income country. It can start with the top up for the household benefits. Afterwards, as in Egypt, for instance, in example of Takaful and Carraro, we can relate household benefits to some individual disability benefits, which should be higher than the individual consumption unit. But we need to consider other part like caregivers allowance, social services, which is very important and should be developed. Both specialized services and care and support. Assistive devices in different inclusion measure allowing children with disability to be enrolled in ordinary schools, person with disability to help to find jobs. So all this measure can cover the extra cost related to disability, and afterwards every country select, of course, whether it will be covered by social insurance measure or social assistance. It's related to the history and the different factors. So on this, I would like to thanks once again all presenters, and I would like you to invite to follow next stage of these webinars. Mainly in 6th June, we will have the very important discussion on inclusive care and support. And afterwards, we will have some discussion, as Alex said in the beginning, on the healthcare and assistive devices, disability determination and assessment, and finally we will finish this series of seminars by disability cash benefits, which will answer on some of the questions which was raised today. Thank you very much.
Thank you very much, colleagues. Thank you, Andrey. Thank you to the interpreters. Thank you to all the participants. And thank you to the team of socialprotection.org. It's always a pleasure to work with you. Thank you for your support. And yeah, let's meet all together again on the 6th of June for the next webinar on community care and support. Thank you very much, colleagues.
Goodbye.